what I tell my patients is always to keep positive. Like there's always options. It might not be the one that they were thinking at. I'm originally from Venezuela, so I'm from South America. I went to do my obs and gynae training in Spain. When I was doing my obs and gynae training, I was really into obstetrics and high-risk maternal medicine. So I ended up doing a master on that. But it was just 1 month of rotation into IVF, which really captured my interest. And then I decided to move into IVF and being a fertility consultant. When I was 12 years old, I was diagnosed with cancer. I had my womb ovaries removed. I always knew that my way into motherhood was going to be a tricky one. I met my other half when I was very young, only 24. And the first thing I said to him is just like, look, before you fall in love with me, I can't have children. So we need to figure it out. We're still together. We do have a lovely daughter. She's 4 years old through egg donation and surrogacy. But the reason that brought me into fertility was I really wanted to help other people achieve that dream. That for me was very, very important. I think the most important thing for us, fertility consultants, if a patient has done any treatment elsewhere or before, is looking at that history in detail. So trying to take apart each step of the journey that they've been in before and try to understand at which step of the way can we do things better or things could have been improved. Or even if a patient hasn't gone through treatment before, like what is the preset of them starting IVF? Is there anything else that we need to look at in terms of investigations that could lead to then explaining a poor quality on the eggs or a poor quality on the sperm or any contribution that might explain why pregnancy is not happening? And that is from the technical point of view, but I think it's also very important to walk with those patients along the way and grab their hands and walk them through it, because I was explaining before, it's a very emotional and tough journey to be on. So being available for patients, I do give my number to all my patients, being available to them. If you need anything, please just text. And it may be that I don't reply on the same day, but I do try to get back to them as soon as possible, because I think that also helps them to feel supported. It definitely makes a difference in terms of the outcome as well in the end. For us, it's important for patients, even if they don't have a positive outcome, that they walk out of here thinking, okay, this team has really put like all the effort and they have gone above and beyond to try to make this happen for us.